Shocking! The Jamaica Medical Doctors Association says it is not in support of doctors who are reportedly part of an underground COVID-19 testing market. A Sunday Gleaner probe has revealed that several doctors are doing unauthorized COVID-19 testing. But the opposition says it is up to the government to widen the pool of approved testing entities. Giovanni Dennis has that report.
A growing racket, or as Jamaicans say, bandool practice, medical professionals doing unauthorized COVID-19 testing. It's a concern for the health minister, as quoted in a Sunday Gleaner investigation. No, the Jamaica Medical Doctors Association is disassociating itself from the doctors involved.
We would not recommend or promote any doctors to be doing any testing that is not in keeping with the Ministry of Health and Wellness protocols. And we would suggest that all persons, and we recommend all persons that are being tested, ensure that where they're being tested is in collaboration and approved by the Ministry of Health and Wellness, and they have released a list of approved labs, and we recommend that persons only go to those places to be tested.
But the opposition spokesman on health, Dr. Maurice Guy, believes the problem has arisen because not enough labs and medical entities have been approved to do COVID-19 testing.
Part of the problem is the lack of opening up of the market. Wherever you have a restriction in terms of what one can get, there will always be the underground trade that will give it to you. If the ministry had engaged more than just the 7 laboratories in doing it, engaged private practitioners, whether they wanted to be trained or so to offer it in the offices, then it would be the way to avert the potential for any underground testing.
The underground testing raises concerns about the accuracy of the reported confirmed COVID-19 cases. The underground practice is also unethical since COVID-19 is a Class 1 medical disease, which means doctors ought to report confirmed cases to the health ministry. But the health minister is quoted as saying that is not being done.
We would be expecting that any doctor that's doing any testing would report their numbers to the Ministry of Health and Wellness. It is a Class 1 notifiable disease, and so we do have a responsibility to report these. And I would be shocked to hear that there were doctors who were not doing these things. And if there are, we are not in support of doctors doing this.
My concern is that, and it's from day one, we have never even had the true numbers if we are only to rely on what the ministry gives us. Albeit now we are having a situation where tests are being done and not reported. However, had those arrangements been in place with the doctors or with the entities to have the testing done, then there will be an obligation on the part of those doctors or entities offering the test to report it to the ministry.
The health ministry is warning that persons seeking unauthorized testing do so at their own risk. Giovanni Dennis, TVJ News.